Camera's speeding.
Excellent. Can I just get you to say your name as an introduction?
Hi, my name is Dr. Neera Bhatia, and I practice obstetrics and gynecology. I've been in practice 30 years, and I'm in San Antonio, Texas. I'm board certified in OBGYN. Hormone therapy has always been a really big interest of mine, and particularly with the introduction of the bioidentical hormones, which I have incorporated in my practice. In the last few months, I have noticed my patients being very pleased with the results in a very short period of time, and I myself have actually had a pellet placed and have noticed significant changes. So I practice what I preach, and needless to say, the results have been fantastic.
Okay.
That was great, thank you.
Whenever he asks you a question, keep your eye line on him and try your best to try and repeat the question as
Okay, so not on the camera?
No, ma'am.
So I was looking at the camera, is that
That
okay?
was
That's
good.
okay.
That was
That's okay.
perfect.
Okay,
We'll use that somehow.
Yeah.
okay.
Okay, question one. What is bioidentical hormone replacement therapy?
Bioidentical hormone therapy is basically, in a very simple term, balancing a patient's hormones with an absolutely natural product that mimics their own, whatever their own body made when they were younger, and their ovaries or their testicles were working at full potential. And these hormones are plant-based, so there's no chemicals involved. So they're the purest form of hormone replacement that matches your own body's replacement. So the body recognizes that and accepts it, and the results therefore are much more superior and more predictable than synthetic hormones.
Okay, can you give some examples or personal stories about bioidentical hormone replacement therapy?
Yes, my patients, I've been inserting pellets now for the past 4 months, and so I've had several patients that have been back to get their hormone levels rechecked and or talk about what their response has been. And I must admit that in about 90% of my patients, their satisfaction level has been greater than 90%. Almost all of their symptoms have, if they have not abated completely, they're at least lessened to a more tolerable level. I've had patients talk about mood stabilization. They're not running around being so angry and upset and snippety about small issues that we have in life every day, to the more deeper symptoms. We're talking about their intimacy and how that's really improved, that they have more desire and they're more satisfied with their sex life. And then in general about their sleep patterns and tiredness. I still haven't received any feedback on weight, but I'm sure that as we go along with duration and as their body gets used to it, they will start showing me that loss of body fat.
What are some of the benefits of BHRT?
The benefits of BHRT that I see is that it's a customized therapy for each individual patient, whether it be male or female. In the past, all the hormones that we had available were very standard. You start at the low dose, you raise it up, and there was never anything based on what your blood work showed. So the best part is that when the patient comes in and the blood work is done, you can customize their treatment based upon their blood work and their symptoms. And so that, to me, is the most accurate form of replacement and balance of your hormones compared to where we were with chemical hormones.
What exactly are the goals of BHRT?
The goals of BHRT are we are trying, in a very simple resolution, trying to get the body to be as close in its function as it was prior to when you start losing hormones.
Okay, what is pellet therapy? What does it consist of?
Pellet therapy is a form of bioidentical hormones that is plant-based and is actually put into a small pellet, it's the size of a rice grain, and it's implanted under local anesthetic in the office. There's no downtime. After the initial blood work is obtained and the dose is calculated, it calculates both the requirement of estrogen and testosterone in women and testosterone in men. It is placed in the fat over the gluteus muscle in the butt, or in the, can you take that off?
Yeah,
in the buttock area. And after it's placed, the patient has minimal discomfort. Then it starts to be absorbed or accepted by the body, and it gets into the capillaries, which are the little blood vessels, and starts to provide a steady state of hormone replacement, which is, as the body needs, no ups and downs. It's pretty steady.
What are the pellets exactly?
They're just hormones that are manufactured to be, as you may say, condensed into a very small size of a rice grain pellet, so that people don't have to apply it on their body or take it orally. So they eliminate the absorption through the skin, which is very inaccurate because you can rub it off or your body can absorb it variously. And you don't have to take it orally because it doesn't have to go through your liver and produce other side effects. So it's simple, it goes directly into the bloodstream, it stays there, it provides constant level till such time as it's totally done, and the effectiveness varies in patients between 3 to 6 months. It depends on how quickly your body uses it. If you're very active or an athlete, you probably will use the hormone therapy up faster and will need replacement sooner than somebody that's not so active.
What distinguishes pellet therapy between men and women?
Both are hormones. In men, it's testosterone only. In women, it's generally a combination of estrogen and testosterone. Though, however, and I've noticed in some of my younger patients, their estrogen may be totally normal and all they're missing is the testosterone. So this is all just based on lab work.
What if my primary care physician or someone's gynecologist says that there is data to support the use of pellet implants?
Well, pellets have been used in Europe for a really long time, and if there are studies that are on our BioT website that people can go into and study, and it supports the efficacy and advantages of hormone therapy, and also discusses, there are several articles that discuss the side effect profiles and how it is much less than chemical hormones.
So can you describe a little bit about what the process is for a consumer that is considering pellet therapy?
So when patients either hear about pellet therapy or they're investigating it, generally they make an appointment with their physician. And the first initial appointment in a gynecologist's office, generally if it's a woman, they will have their annual exam, their pap smear, their mammogram, and then some blood tests. And these are generally covered by our insurance. They're pretty standard blood tests that check you for hormones, your thyroid, check your liver, make sure everything is totally normal. And the pellets are then explained to the pellet therapy is then explained to the patient, and once the lab work returns, we are able to calculate the dosages based on a formula that we have as to how much estrogen and testosterone, or just testosterone, is needed based on if they're a female or a male. And Once that is done, the patient comes in. It could just be a lunch hour from work. There's no downtime. You can eat anything you want before that. We just use a local anesthetic to numb the area and insert the pellet through a very small opening. It's a few millimeters, and once it's placed, there's no stitches involved, and the patient can return to her activities in no time.
Let me take a break here.
So there are several kinds of hormone replacement therapy. I'm sure people are aware about it. The thing that is exciting about BioT is that it's something that you don't have to remember to take. Once it's in there, it's there doing its job. It's not a cream that you have to apply like a lot of other hormone therapies. It's steady state, so there's no ups and downs compared to oral therapy, where if you took it, if it gets absorbed or it doesn't get absorbed or you forget to take it, there could be ups and downs. And it is plant-derived, and the hormones are the closest that the own body makes. And so we are just trying to balance the hormones in your body that were in balance when you were younger and just have been off balance now, and so that's just bringing you back to your normal state.
What are the pros and cons of using bioidentical hormone replacement therapy in women?
Well, there's advantages of hormone therapy are pretty similar to what chemical hormones are supposed to do, and we have several studies that show that first of all, you get complete relief from all the symptoms of menopause, including hot flashes, night sweats, decreased libido. And in addition to that, the memory loss that people experience when they do have decreased hormone levels, anxiety, irritation, depression, bone density loss, cholesterol changes, accelerated heart disease. These are all symptoms that that can be alleviated or at least slowed down by using BioT.
Can you explain estrogen bioidentical hormone replacement therapy as opposed to testosterone bioidentical hormone replacement therapy?
So estrogen bioidentical hormone therapy is used in women where, when a woman is younger or pre-menopausal, the ovaries make both estrogen and testosterone. And so the estrogen is usually the one that goes down, and in some women the testosterone goes down too. So the changes, the estrogen actually helps to keep the bone density in women, prevents, is the one that keeps you from having hot flashes, and good night's sleep is based on how much estrogen you have. And if you're lacking that, then all of those things all add up. So you get a very tired person with immense hot flashes, interrupted sleep patterns, a change in your metabolism resulting in increased fat accumulation around the waistline, decreased libido, and on and so forth, to where it just completely changes your life, and it's like your body is missing a big piece that needs to be fixed.
Okay. What are synthetic hormone? What is synthetic hormone replacement therapy?
Synthetic hormone replacement therapy is your traditional therapy that we've heard of for many years. It's Premarin, Senestin, just estradiol that's made from chemicals. Like in Premarin, it is made from the mare's urine. It doesn't match or mimic your own therapy, or what your own body makes. And so, not to mention that the dosing is very inaccurate, so you could have side effects from it because you got overdosed, or you take a dose and it's too low and then you have to go back and it's titrated, and then it may be too high because it's not individualized. It is just whatever is available.
Why is bioidentical hormone replacement therapy the right choice for consumers?
Bioidentical hormone is the right choice because it's plant-derived, the closest to your own body's hormone, particularly pellets, which are easy to insert. And there's no need to take anything orally, no creams to apply. It works constantly and brings your body balances your body's hormones to your pre-menopausal state.
Would it be possible for you to give some examples of men and BHRT, more specifically percentages of men losing testosterone at what rate and age?
Can you stop that for a minute?
Yeah, it's. I mean, if not, we can move on. That's very specific. I know.
I think it's after age 30. Damn, I think I have it in my book. Let me go. I don't want to give it wrong. It's known that men between age 30 and 70 will lose approximately 1 to 3% of their total testosterone, available testosterone. And so that may account for a lot of the symptoms in men, including decreased libido, difficulty having an erection and keeping it, and decreased desire in sex, weight gain, cholesterol changes.
What are bioidentical hormones?
Bioidentical hormones is hormone therapy that is natural, generally plant-derived, mimics closely what your own body makes, particularly BioT is in the form of pellet therapy, which is inserted in the fat of the buttocks to provide constant hormone replacement to match your own bodies, to keep the body symptom-free 24 hours a day based upon each individual's lab work and their hormone needs of each individual.
What as a patient could I expect bioidentical hormones to do for me?
Generally, after the pellet is inserted, most patients will start feeling some improvement, particularly women, in their hot flashes within 72 hours of insertion. And thereafter, it just starts to get better. In my experience, I've had patients get their mood stabilization within a week or two. I've had patients get their sexual desire improvement within the first 3 or 4 weeks. The hot flashes and night sweats are better within a week or two. And so by the time they're back for their repeat lab work at 2 months, about 90% of my patients are either symptom-free or have had a vast improvement of their symptoms.
How often do patients need treatment?
The BioT treatment varies. The reintroduction of the pellets after the initial pellet is anywhere between 3 to 6 months based upon your body's needs and your lab work and the amount of pellet hormone that's given to the patient. So if a patient has a pellet inserted and her is improving and her lab work is improving, we just ask them to give us a call back when they start getting some of the symptoms back again. So the initial therapy is based on the lab work, and the subsequent therapy is based upon the patient's symptom return. If the symptoms return, then we will schedule another pellet insertion.
Are there any side effects or complications?
If a patient is selected correctly, and we generally follow the same rules that we do for chemical hormone replacement, We offer it to all patients, but we keep in mind if there's a history of breast cancer, we generally will not do the estrogen portion. We may still use the testosterone. The only side effects that I've had patients mention to me have been some breast soreness, which generally is within the first 2 weeks of insertion of the initial pellet. And once the body accommodates it, they have had regression of that. I have not had any other complications on any of the patients.
If someone is known for getting horrible headaches, will this do anything for them?
I have had patients that this has improved their headaches. Generally, the headaches are what we call menstrual migraines. As you remember, in younger patients, when they're on their period, their headaches get worse. So as patients go into menopause and the estrogen decreases, they can worsen their headaches. So just stabilizing the estrogen will help patients that are having migraines that are related to low estrogen.
Why wouldn't a doctor suggest bioidentical hormone therapy as an option?
Sometimes I think it's a lack of knowledge and not investigating other avenues other than chemical hormones, because they have been available and obviously have been advertised for a long time. So this is just a matter of getting the information that is available from the bioidentical hormones to be used into your practice.
If I were a woman, would I still need estrogen?
Yes, most women start losing estrogen even as early as 30 years of age. So when women come in with their when they're in menopause or perimenopause and the lab work is performed, we are able to assess by doing a measurement of a test called an FSH level, where how far into menopause they are, and then we can correct that by introducing the pellet.
If I have low libido, will this do anything for me?
Yes, it does. And generally the low libido is not just from the estrogen in women, it's from testosterone. Of course, in men, it's generally just testosterone, and this will definitely improve.
Will I grow unwanted hair from the testosterone?
Generally, I caution women that already have a propensity to increase facial hair or body hair, that may occur, but most of the time it's just temporary. Once their body gets used to it, it will not be as noticeable. So it's just a matter of letting women know that, already have some increased issues with that may be a side effect.
Are there any other medications that are required to go along with treatment?
Generally, we check the patient's thyroid, because a lot of times in menopause the symptoms are aggravated by thyroid disease, so we want to make sure that there's no thyroid medication necessary. In women that have not had a hysterectomy and we prescribe estrogen in the form of pellets, we would like to give them a small dose of progesterone, and that's generally called prometrium. It is a very natural progesterone that women can take at night, which, by the way, also helps with their sleep. It's slightly sedating, and that will prevent any increase in lining of the uterus that can promote development of polyps or bleeding, etc.
Okay, and the last question, where do I need to go, or who do I need to contact in order to get more information on pellet therapy?
Most of the information is available on the BioT website, and the website will actually link you to the providers or the doctors that are actually providing this kind of therapy in the areas where the patient is looking. And their website will then link on to our individual websites, and then we have information on our website that patients can call and set up an appointment and come in for a free consultation, and we'll be happy to let them know more about introduction of pellets and what it does for you.